Insulin resistance starves the gums of oxygen. Here is the unspoken clue. A patient comes into my office with bleeding gums. She says she flosses, she brushes, she rinses. She does everything right, but yet nothing improves. Her hygienist says you need to floss more often, and her dentist recommends a deep cleaning. But after months, there's no real change. Now, why is this? Well, because this isn't a hygiene issue. Now, don't get me wrong, there are hygiene issues, absolutely. But this one, it's a metabolic signal, and no one is talking about it. So, welcome to the Obesity Project, episode 75, Bleeding Gums. Here's what your dentist won't tell you. My name's Dr. Mark Shankman. I'm an oral and maxillofacial surgeon, and I have an interest in not only your mouth, but in your whole body and your metabolism. So let's start off with how the gums are metabolically active tissues. So your gum tissues, or gingiva, are made of collagen, connective tissue, and tiny capillaries. So they require several things. They require oxygen, nutrients, stable insulin signaling to heal and stay healthy. There was a 2020 review in Journal of Clinical Periodontology that found that even in non-diabetic insulin-resistant individuals, these people had impaired gum tissue regeneration. And this was a study by Pollock et al. In that 2020 journal. So it's sort of like building a house with broken tools. You can put up the bricks, but they're just not going to last all that long. So what we found is that insulin resistance starves the gums of oxygen. So in insulin resistance, blood vessels constrict. Nitric oxide production drops. And nitric oxide is a chemical in our bodies that cause vasodilation or expansion of those blood vessels. So when we lack nitric oxide, we get a constriction of those blood vessels. And so what happens then is capillary flow gets sluggish, and capillaries are the smallest vessels that actually feed the blood, the oxygen, the nutrients to the individual cells. So that capillary flow becomes sluggish or slows down. And so what's the result of this? The result is your gum tissue, the front line of oral health, starts to suffocate. So there was a study in Diabetologia. I'm not exactly sure how to say that journal, but in 2015 that showed reduced capillary perfusion and delayed healing in early insulin resistance long before diabetes sets in. So the patient who takes 3 weeks to recover from a simple scaling or prophylaxis or a cleaning, they typically will bleed for days. They need repeat cleanings, and that's not poor hygiene, that's poor perfusion, poor oxygenation. So another thing that happens is inflammation blocks collagen repair. And so insulin resistance isn't just about sugar, it's about inflammation. And inflammation interferes with every layer of oral tissue and many of the layers of our regular tissues throughout the rest of our body as well. But some of the things we see in oral tissue, we see elevated TNF alpha and IL-6, or tumor necrosis factor alpha, and interleukin 6. These are inflammatory mediators that I've been talking about in the last few videos, but these really affect not only all of the tissues in our body, but certainly our gingival tissue, our gum tissue. So we get these elevated inflammatory markers. We get chronic activation of immune system cells, and we get disrupted collagen turnover. So collagen is the sort of backbone of all of our tissues, our gum tissues, our connective tissues that support the gum tissue and the teeth. The bone is created from collagen. So all of these things in our oral tissues are created from collagen, and inflammatory markers and inflammation disrupt this collagen turnover. So imagine this. It's sort of like trying to patch drywall in a room that's literally still on fire. Well, in that case, nothing's going to stick. And that's what happens in our oral cavity. So here's why traditional dental care fails. So scaling and root planing are helpful. That's the cleaning of the tartar and the polishing of your teeth, and cleaning up the pockets around the teeth. So scaling and root planing are helpful. Antimicrobial rinses do have their place. So Listerines and Paradex that you may get from your dentist, which is chlorhexidine. But if the root issue is insulin and that's not addressed, then none of that stuff is really going to help you. Might moderately help, but it's not going to have a major return. So what happens then? Inflammation returns, the gums keep bleeding, and the cycle repeats itself over and over and over again. And frustration sets in both on your dentist part and your part as the patient. So in oral diseases in 2018, they showed that standard periodontal therapy or gum therapy was 40% less effective in insulin-resistant patients, regardless of compliance, so regardless of how much they brushed and flossed. So let's look at two patients, same toothbrush, same dentist, different outcomes because of their metabolic status. And when I say same toothbrush, I don't mean they're literally using the same toothbrush. They're using the same type of toothbrush. Okay, that's disgusting. I know what you were thinking. Stop thinking it. All right. So healing the gums start with the signal. So when patients reverse their insulin resistance, we don't just see lower blood sugar. We see things like less gum bleeding, like you see behind me. Smaller pockets, the pocket of gum tissue around those teeth that the dentist is always poking that little poker in, measuring the depth, because the deeper that gets, the harder it is to clean, and the more periodontal disease or gum disease you get. So you get less gum bleeding, you get smaller pockets of gum tissue around the teeth. You get improved surgical healing. So if there's surgical intervention needed or necessary, you're going to get better healing after those surgical procedures are done. And then you also get reduced inflammation absolutely across the board. So the bottom line on all of this is, if your gums are not healing, stop just looking at your mouth. Start looking at your metabolism, and your dentist and your doctors should start looking at your metabolism too. I'm the first person to say the dentist is limited, and that's not a knock on dentists. I'm in the dental profession. That's their main focus is on brushing, on flossing, on plaque buildup, on tartar buildup. And when they don't see improvement despite adequate hygiene, they're really kind of at a loss. Because I'll be the first to tell you that in dental school, just like in medical school, there's very little on nutrition. There's very little on metabolism. There's very little that's really pointing the finger at inflammation, on insulin resistance, and all of these things that go along with it. So, as I mentioned in many, many videos, insulin resistance is the core problem, the root problem behind many chronic diseases. And unfortunately, like many of the physicians out there, are not really paying attention to what happens in insulin resistance and chronic inflammation. The same thing is happening in the dental profession, where the answer is just more cleanings and more toothbrushing and more flossing, and yet there's no improvement. And unfortunately, the finger of blame gets pointed at you. This is just like how we blame obese people for being obese, when it's not an obesity issue. It's really a hormonal hijacking and a toxic food environment that's creating that problem. So just remember that if your gums aren't healing and you're doing a great job at hygiene. Now, great job of hygiene means you're not just flossing. I'm sorry, you're not just brushing, you're flossing too. And many people will say, well, I brush 3 times a day. And I'll say to them, well, how often do you floss? And they're like, not that often. Well, the truth is, and I tell this to patients all the time, floss the ones you want to keep. Don't worry about the rest. You don't need them. So floss every tooth. You got to do that. But if you're doing that, right, if you're brushing 2-3 times a day, you're flossing at least once a day, and we're not seeing progress, then you got to start looking at some of these underlying causes like your metabolism, like insulin resistance. So this has been episode 75 of the Obesity Project. Bleeding gums? Here's what your dentist won't tell you. So if you're stuck with chronic gum disease, don't assume it's because you're doing something wrong. You might actually be doing everything right, but no one ever told you to fix your insulin. Your dentist never told you to fix your insulin, and barely your physician tells you to fix your insulin. And you have to remember that bleeding gums don't just come from plaque. They come from a system that's already inflamed. And don't forget, here on the Obesity Project, we're cutting through the myths, getting to the root. Thank you so much for watching. Let's fix those bleeding gums, and I'll see you in the next video. Take care.